The Effect of Vaping on the Human Body by Raimundo Lugo, Kimberly Maldonado, Isaiah Mesa, and Jocelyn Montelongo. I'm Jocelyn, and I did slides 1, 2, 5, and 6. So, in 2003, Chinese inventor Han Lik invented the e-cigarette. In 2010, there was a higher demand for them, and people wanted a better experience with them with different flavors as well. Although many are aware of the damages that vaping can cause, people still want more and are looking for more ways to vape. In 1798, Dr. Benjamin Rush was one of the first to point out that smoking can prompt incurable diseases and cancers. Ever since then, many have tried to come up with ways to get high without smelly cigarettes.
Health officials point to vitamin E acetate as the primary cause of EVALI. Vitamin E acetate is an additive found in THC-containing vaping products. EVALI stands for e-cigarette or vaping use-associated lung injury. It appears to be a form of acute lung injury with pathological findings of acute fibrinous pneumonitis, alveolar damage, or organizing pneumonia. Statistics: incidence, risk factors, prevalence, and mortality. Key risk factors of EVALI are THC and vitamin E acetate. More than 2,800 cases of EVALI have been reported, and among those are 68 deaths. Approximately 66% of patients have been male, and nearly 80% have been between the ages of 13 and 35. Reported cases that have resulted in death are higher in individuals older than 35 and those with a history of asthma.
There are many signs of vaping that include increased thirst, which is caused because vaping removes hydration from the skin, especially the mouth and throat. People who vape also tend to have a sleep pattern disturbance. If your child is active daily and starts having trouble breathing during their performances, this can be a sign of vaping. Bloodshot eyes are also a physical effect of vaping, and mood swings and strange odors may also be a sign of vaping. Stage 1 includes feeling one of these symptoms within the first 15 to 60 minutes. These symptoms can include nosebleeds, dizziness, sweating, increased heart rate, weight loss, dry mouth, and excessive saliva. Stage 2 appears within a few hours, and these symptoms can include low blood pressure, weakness, pale skin, and diarrhea. There may also be serious symptoms that include seizures.
Complications of vaping, which include lung cancer and issues, brain damage, mouth and gum disease, and heart issues. Nicotine raises your blood pressure, spikes your adrenaline, resulting in increased heart rate and greater risk of heart attack. Treatment for vaping includes lung function test, a CT scan, a urine drug test, and testing for infections. It's very important to assess the concerns for infection and to pursue treatment if the concern is substantial. The decision to treat for infection can be complex, one given how EVALI presents similarly to infection.
Discussion Article 1. For this article, we have to get information from medical Dr. Luana P. Gordon. She happened to inform us on the shapes of vaping that are taking place upon us. These e-cigarettes are killing our society as much as a regular cigarette, but these companies make it seem as less harmful. The information that these companies provide during their commercials is frying our youth's minds.
Diagnosis of vaping. Many patients present with symptoms that were very similar to pneumonia or viral gastroenteritis, except they have extensive radiology findings that were much worse than clinicians expected. And some of these patients, when on the required care in the intensive care unit, the algorithm in the accordance with CDC guidelines recommend that physicians consider EVALI as a potential diagnosis if patients have reported vaping or dabbing in the past 90 days and exhibit respiratory distress, gastrointestinal symptoms, and radiology findings of occupancies of both lungs.
Conclusion. In conclusion, these companies are making another illegal toxin killing us. Companies are producing mass productions of these vaping modules. To young people within our society, they are consumers of these products, having little to no knowledge of what they are smoking. Illegal smoking of cigarettes or even these new e-cigarettes are frying our bodies mentally and physically. At what point shall we stop or prevent further production of these killing products?